watching CBS 2 News in high definition.
Also in today's Go New York Health News, dry eye syndrome affects about 59 million Americans, and it's difficult to treat. Drops and warm compresses give patients some relief, but it's usually only temporary. Now, a laser skin procedure has turned out to be an effective treatment for the eye condition. Susan Newberry suffers from dry eye syndrome and has to use eye drops about 15 times a day.
It can be painful, your vision is hazy, it's like you're looking through foggy glass sometimes, and it's just really annoying. Newberry
has suffered since college and has tried various remedies. She actually works for an eye doctor who decided to try something new to improve her tear production: intense pulsed light therapy, or IPL.
So it's the quality of tear that's important, not necessarily the wetness of the tear.
Our tears are more than water. Moisture is locked in by an oily layer, and that oil is produced by glands under the eye. In many dry eye patients, the glands are blocked and don't secrete enough oil, causing water to evaporate. The warm light therapy opens up the glands, improving moisture. Dry eyes are worsened by sun, wind, high altitude, and a dry climate. Also, when we work on a computer for many hours, we don't blink as much, and that causes our tears to evaporate. The procedure was actually discovered by accident. IPL was invented to treat skin conditions like rosacea and acne. But soon, skin patients were telling doctors how their dry eye improved.
There's no downside. It doesn't cause damage to the eye. It doesn't cause damage to the skin.
This is Newberry's first treatment. Most patients need 4, and it's not a cure.
You know, I'm not expecting miracles, but some improvement would be really nice.
Researchers say almost all patients do get some relief from dry eye. Saline drops are the most common treatment for dry eye syndrome, and if used on a regular basis, most people don't have any long-term complications. However, if left untreated, severely dry eyes may lead to eye inflammation, infection, and scarring on the surface of the cornea.
So how do you know if you have it?
Primarily, it's itchy, burny, just uncomfortable eyes most of the time. Some of the more subtle symptoms, you may have difficulty wearing your contact lenses, and for some people, their eyes feel tired, just fatigued and blurry at the end of the day.
If you have trouble under these lights, could that be a sign?
Certainly. I think with normal eyes, we'd have trouble under these lights, but dry eye would make it even worse.
All right. Thanks, Doctor.
Thank you, Dr. Hawley.